Let me tell you about someone I once heard about. She was 68, quick-minded, organized, and sharp in the way families never forget. She finished the crossword every morning before most people had their coffee. She remembered birthdays, appointments, recipes, and phone numbers without checking a screen. Her family used to joke that she was the search engine of the house. Then about a year and a half after one more prescription was added to her daily routine, everything started to shift, slowly, at first, then all at once. She forgot what she had eaten that morning. She got turned around driving home from the same grocery store she had visited for years. She began repeating the same question again and again in a single afternoon. Her family panicked. A specialist suspected early Alzheimer's. Everyone felt the floor drop out from under them. But here is the part no one had explained to them, and it matters more than most people realize. It was not Alzheimer's at all. It was what was sitting in her medicine cabinet. When her medications were reviewed carefully and changed with medical guidance, something surprising happened. The fog began to lift. Within a few months, she was doing the crossword again. She felt more like herself. This is not a miracle story. It is a warning story. It is a reminder that sometimes the thing stealing your memory is not aging itself. Sometimes it is a pill bottle hiding in plain sight. And today I want to walk through 9 common medications and medication patterns that may quietly affect memory, focus, and mental clarity after 60. Stay with me to the end, because the last one is not just one medicine. It is a hidden pattern affecting millions of older adults right now, and almost nobody talks about it clearly enough. Before we go further, let me say this carefully. Do not stop any medication on your own. Please do not do that. The goal is not fear. The goal is awareness. You have every right to ask what is going into your body, what it may be doing to your brain, and whether there is a safer option. A lot of people keep a sleep aid or allergy pill near the bed and think nothing of it. It feels harmless, it is over the counter, it is cheap, it is familiar, and that is exactly why it gets missed. One of the most common examples is diphenhydramine, the ingredient found in many nighttime products and old-style allergy medicines. On the label, it may look simple. Inside the brain, especially after 60, it can be a different story. This drug belongs to a group called anticholinergics. That word matters. You are going to hear it again and again because it sits at the center of this entire conversation. Anticholinergic drugs block acetylcholine, a brain chemical deeply involved in memory, attention, alertness, and learning. When you are younger, your brain often has more room to compensate. With age, that reserve gets smaller. So, when a medicine blocks more of that system, the effects can hit harder than expected. Not always in one dramatic moment, more often in quiet ways, more confusion, more mental fog, more forgetfulness that gets blamed on just getting older. The tricky part is that diphenhydramine hides everywhere. If a package says PM, nighttime, sleep support, or night relief, there is a good chance that ingredient is inside. That means many people are taking it without even realizing they are using a strong anticholinergic. If you use it often, it is worth asking whether a second-generation allergy medicine might be easier on the brain, or whether your sleep issue needs a different answer completely. And keep watching, because sleep is going to come up again in a big way. What looks harmless is not always harmless. What feels routine is not always safe. That is why this matters. If something in this is already making you think about your own pillbox, keep going, because the next few examples are even more common and even more overlooked. Another big one is acid reflux medicine, especially proton pump inhibitors, often called PPIs. Many people are told to take one every morning and then just keep taking it year after year without anyone ever revisiting the plan. That is the problem. These drugs were often meant for shorter windows, but in real life, they can turn into a long-term habit that never gets reviewed. On the surface, the logic seems easy. Less stomach acid, less burning, less discomfort. But the body is never that simple. Stomach acid is not useless. It helps break down food and helps absorb key nutrients, especially vitamin B12. And B12 is not optional when it comes to the brain. It plays a major role in nerve health, memory, mood, and mental sharpness. When levels fall too low, the symptoms can look frighteningly close to early dementia. Memory slips, mood changes, nerve symptoms, confusion, fatigue, trouble thinking clearly. That is what makes this so deceptive. A person may think they are developing a neurodegenerative disease when in some cases a nutrient issue and medication pattern are part of the picture. There's also concern that long-term use may affect the brain in other ways beyond nutrient depletion. That does not mean everyone should panic or throw away their medicine. It means this should not stay on autopilot forever. If you have been taking one for years, it is reasonable to ask whether it is still necessary, whether the dose is still right, whether a step-down plan exists, or whether other options like meal timing, smaller portions, avoiding late eating or changing sleep position might reduce symptoms. This is where real prevention begins, not with dramatic fear, with calm questions, with a medication review, with one doctor actually looking at the full picture instead of only the symptom in front of them. And now we need to talk about a category that many older adults take in silence because it is tied to embarrassment, lost sleep, and quality of life. That next one catches a lot of people off guard. Bladder control medicines are a perfect example of a treatment solving one problem while quietly creating another. Overactive bladder is real. It disrupts sleep, freedom, confidence, travel, social life, all of it. So when someone is handed a prescription and told it will help, of course they try it. But many older bladder medicines, especially oxybutynin, can be very hard on the aging brain. This is not a small detail. It is one of the strongest anticholinergic medicines still commonly used. That means it does not just calm the bladder. It can also cross into the brain and block the same memory pathways older adults are already struggling to protect. The result is not always dramatic on day one. It may show up slowly as forgotten appointments, lost words, trouble following conversations, or that strange feeling that thoughts are moving through mud. Because it creeps in gradually, families often call it normal aging and move on. That is what makes it dangerous. The same pattern shows up with benzodiazepines, medicines often used for anxiety, panic, or sleep. These can feel like lifesavers in the short term. They quiet the brain fast. They reduce panic fast. They can knock out insomnia fast. But when they stay in the picture too long, the cost may grow. These medicines increase the calming signal known as GABA. Over time, the brain may start leaning on that outside push instead of maintaining its own balance. Learning slows. Memory can dull, reflexes fall, emotional steadiness changes. The person may feel calmer in one sense, but less mentally alive in another, and then comes the trap. If they try to stop suddenly, the rebound can be brutal. Anxiety surges, sleep collapses. The medicine now feels necessary, even if it is part of the problem. So hear this clearly. Never stop these drugs abruptly. Never. If there is a concern, it has to be discussed and tapered slowly under supervision. Stay with me, because the next group surprises people even more, especially because many assume it belongs on the safe list by default. Now let's talk about statins, because this topic needs honesty and balance. These medicines can absolutely help protect some people from serious cardiovascular events. For many patients, they are appropriate. For some, they are life-saving. But that does not mean no one should ever question side effects. The brain is rich in fat. Cholesterol is not just some villain in a chart. In the brain, it helps support nerve insulation, signal speed, and communication between cells. So, when cholesterol is pushed down aggressively, especially in older adults, some people report mental side effects like brain fog, confusion, and memory changes. Not everyone, but enough that the conversation should not be dismissed. One detail that often gets ignored is that not all statins behave the same way. Some are more likely to cross into the brain than others. That means the experience can vary depending on the exact drug, dose, age, and the person taking it. Another piece people rarely hear is the issue of CoQ10, a compound involved in energy production that statins may lower. And if the brain is an energy-hungry organ, that matters. Then there is amitriptyline, an older medicine still used for nerve pain, migraines, poor sleep, and mood. Many people take it for reasons that do not even sound psychiatric. That is why it slides under the radar. But it is one of the stronger anticholinergic drugs still hanging around in everyday practice. And long-term exposure can quietly add to cognitive burden, not with fireworks, with erosion, trouble finding words, trouble organizing steps, trouble holding several thoughts at once. The kind of changes families notice only when they look backward and realize the person has been fading for a while. This is why a medicine list needs more than a quick glance. It needs someone asking, what is the burden here? What systems in the brain are being pushed in the wrong direction day after day? If this is making you rethink how normal your current routine is, good. That is the whole point, because what comes next is even more unsettling, especially for people with loved ones in hospitals, rehab units, or long-term care settings. Some of the most troubling stories involve antipsychotic drugs given to older adults who are not truly psychotic but are restless, confused, upset, wandering, or difficult to manage in an overwhelmed care setting. That is a hard sentence to hear, but it needs to be said. These are powerful, brain-changing drugs. They were created for serious psychiatric illness, not as a shortcut for behavior control in older people whose brains are already fragile. Yet in many settings, they are still used too quickly. Families may not even understand what was started, why it was started, or what the exit plan is. These drugs often suppress dopamine, a chemical tied to movement, drive, focus, motivation, and executive function. In an aging brain, too much suppression can flatten a person. Thinking slows, emotion gets muted, energy drops, memory can worsen. A once lively person can start to look vacant, dull, or far older than they did just weeks before. And then people say, this is just the disease progressing, when part of the picture may be medication. That is why direct questions matter. Why this drug? Why now? What alternatives were tried first? What is the plan to reduce or stop it? Then there is paroxetine, often known as just another antidepressant in the SSRI family. On paper, that sounds reassuring because SSRIs are often viewed as the more modern, easier class compared with older antidepressants. But this one is different. Unlike many of its cousins, it has meaningful anticholinergic activity. In simple terms, it behaves in ways that make it tougher on memory systems than people expect from an SSRI. That makes it a poor fit for many older adults, especially when other options may offer similar mood support with less cognitive drag. Yet it still gets prescribed, sometimes to exactly the people who are most vulnerable to those effects. This is why labels and categories can mislead you. Sleep aid does not mean brain safe. Bladder medicine does not mean brain neutral. Modern antidepressant does not always mean low risk. The name on the bottle is not the full story. The mechanism matters. The total burden matters. And now we need to get to the most important part of all, because the biggest danger is not always one drug. It is the stacking effect almost no one sits down to calculate. Here is the hidden pattern that changes everything. Most older adults are not taking one medicine. They are taking several, sometimes prescribed by different doctors, sometimes mixed with over-the-counter sleep aids, allergy pills, pain relievers, reflux tablets, and supplements bought without much discussion. Each individual item may seem reasonable in isolation, but the brain does not experience them in isolation. It experiences the combined load. That is where anticholinergic burden becomes so important. One medication may cause only mild fog. Add another, and the effect can become much bigger than people expect. Not just a little forgetfulness, real confusion, slowed thinking, poor recall, personality shift, even a picture that looks frighteningly close to dementia. Imagine an older adult taking a nighttime sleep product, a bladder medicine, an older pain medication for nerve symptoms, and a daily stomach medicine. Each was started for a reason. Each may have been prescribed by a different person. No one meant harm, but together, the brain may be carrying a burden no one ever measured. That is how people slip into trouble. Quietly, respectably, with a full medicine organizer and no one asking the right question. And here is the hopeful part, because there is one. Drug-related cognitive decline is often missed, but in some cases, it can improve when the medication load is reduced carefully and intelligently. Not overnight, not magically, but enough to matter. Enough for families to say, there you are. You seem more like yourself again. That is why this is worth your attention. Not to create fear, to create action. Start with a complete list of everything you take. Everything means everything. Prescription bottles, vitamins, nightly sleep products, occasional allergy pills, pain relievers, acid reducers, all of it. Then ask for a real medication review. Use those words. Ask whether your total anticholinergic burden has ever been assessed. Ask whether any drug is still necessary. Ask whether a lower risk substitute exists. Ask whether deprescribing is possible. And if your concerns are brushed off too fast, get another opinion. You are not overreacting. You are protecting your brain. What is happening to mental clarity in later life is not always destiny. Sometimes it is chemistry. Sometimes it is reversible. Sometimes the signal has been there all along, hiding in plain sight, waiting for someone to finally connect the dots. And this is where it becomes deeply personal, because the moment people hear that medicines can affect memory, the first reaction is usually disbelief. The second is fear. They start thinking about a parent, a spouse, a sibling, or even themselves. They remember the missed appointment, the repeated question, the strange moment in the parking lot when a familiar place suddenly felt unfamiliar. They remember the sentence that trailed off halfway through because the right word would not come. They remember the frustration in the room, the silence after, the way everyone looked at each other but did not want to say out loud what they were thinking. That is why this conversation matters so much. Because once a person is told, this may be dementia, the label starts shaping every decision after that. Families become scared, patients lose confidence, people stop asking different questions because they think the answer has already been decided. But sometimes the right question was never asked in the first place. Not what disease is causing this, but what medications are in the picture right now. How long have they been there? What changed before the symptoms started? And whether the brain is reacting to a chemical load that has slowly built up over months or years. That is why timing matters. Patterns matter. A new pill added 3 months ago matters. A dose increase matters. A nighttime product bought at the pharmacy without telling the doctor matters. And only as needed medicine that quietly turned into every night matters. These details seem small until you realize the brain notices every single one. It keeps score even when nobody else does. And if you have stayed with me this far, hold on, because the next part may be the most useful of all. It is not just what to worry about, it is what to do next, calmly, clearly, and without panic. Start by treating your medication list the same way you would treat a financial document or a legal paper. It has to be complete, not mostly complete, not the prescriptions you remember off the top of your head. Everything. Write down the daily pills, the occasional pills, the sleep aids, the allergy tablets, the heartburn products, the pain relievers, the cough syrups, the supplements, the natural capsules, the gummies, the drops, the patches, all of it. If it goes into your body, it belongs on the list. Then look at that list with fresh eyes. Ask yourself which ones were meant for short-term use but somehow stayed for years. Ask which ones were added to treat side effects from another medicine. Ask which ones came from one specialist and which came from another. Ask which ones nobody has reviewed together in one room at one time, because that is where the danger grows. Not only from one drug, but from fragmentation. One doctor may know your blood pressure medicine, another may know your bladder prescription, another may know your anxiety pill, another may have suggested a sleep aid, and none of them may be looking at the total burden on the brain. This is why medication review is not some extra little errand. It is a major health event. It can change the direction of a person's life. And when you ask for that review, be specific. Say you want to know whether any of your medications have anticholinergic effects. Ask whether any of them can affect memory, focus, balance, or reaction time. Ask whether the dose is still appropriate for your age. Ask whether there is a safer substitute. Ask whether something can be tapered instead of continued forever by default. Those questions are not disrespectful. They are wise. They are overdue, and they may uncover an answer no one has taken the time to find. The next thing to understand is that recovery, when it happens, is often not dramatic at first. It may not look like a movie scene where everything returns in one emotional moment. It may look smaller than that. A person follows a conversation more easily. They stop asking the same thing 3 times. They find the right word faster. They seem more present at dinner. They laugh sooner. They read again. They remember what day it is without checking. They stop looking so lost in their own living room. Families often describe it in a very simple way. They say, it feels like we got part of them back. That line says everything, because what medication-related cognitive decline steals is not just memory. It steals confidence, it steals rhythm, it steals expression, it changes the atmosphere of a home. And when some of that lifts, even a little, everyone feels it. But I want to be careful here, because not every case is reversible, and not every symptom comes from medication. Real dementia exists. Neurodegenerative disease is real. No one should pretend otherwise. The point is not to claim that every memory problem is caused by a pill. The point is that medication causes are common enough, serious enough, and overlooked enough that they should be checked early, not as an afterthought when everything else has already been assumed. That is the mistake too many families make without realizing they were never given the full picture. They move straight to fear and skip the review that might have changed the conversation. So if you notice sudden confusion, new forgetfulness, major brain fog, personality shifts, extra sleepiness, falls, slowed thinking, or trouble functioning after a medication change, that is not something to casually brush aside. That is a signal. Maybe not the only signal, but a signal all the same. And the earlier it is investigated, the better the chances of seeing what is really going on. There is also something else older adults need to hear clearly, because Too many people feel guilty for asking questions. You are allowed to challenge the assumption that more medication is always better care. You are allowed to ask why a drug was started and whether it still belongs in your life today. You are allowed to ask if the benefit is still greater than the risk. You are allowed to ask if your age changes the equation, because it does. The body at 70 is not the body at 40. The liver processes differently. The kidneys clear differently. The brain responds differently. The same pill that felt manageable years ago may hit harder now. The same dose may linger longer. The same side effect may show up in a more dangerous way. And this is exactly why older adults should never be treated like younger adults with more birthdays. The rules change. The margin for error gets smaller. The need for careful review gets bigger. This is especially true when sleep becomes the reason for adding more and more products. Sleep trouble is common after 60, but using sedating medicines night after night can create a cycle that makes the brain duller by day and more dependent by night. Then comes daytime fatigue, more confusion, maybe a nap, then poorer sleep again, then another nighttime pill, and the loop tightens. That cycle is common, so is the frustration that comes with it. But if sleep is the problem, the answer should not always be another sedating medicine. Sometimes the answer is timing, light exposure, caffeine habits, alcohol habits, pain control, breathing issues, anxiety treatment, or actual sleep therapy. The symptom you feel at night may be real, but the wrong solution can spread the damage into the whole next day. And once that happens, for months at a time, the brain begins to pay the price in silence. So here is the bigger message I want to leave you with. Memory does not disappear in only one way. Decline does not arrive through one single door. Sometimes it is disease. Sometimes it is injury, sometimes it is poor sleep, depression, low B12, chronic stress, illness, dehydration, infection, or sensory loss, and sometimes it is medication. The tragedy is that medication is one of the few causes on that list we may actually be able to change. That should make all of us more alert, not less. It should make families more curious. It should make patients more confident in speaking up. It should make every clinic take medication review more seriously than a rushed 2-minute question about whether you need refills. Because the cost of missing it can be enormous. A person may be labeled as declining when they are actually over-medicated. A family may lose hope too early. A patient may lose independence faster than necessary. And all because nobody paused long enough to ask what the chemistry might be doing. That is why this is not just a medical issue. It is a quality of life issue. It is a dignity issue. It is about whether someone gets to stay mentally present for conversations, birthdays, drives, jokes, books, and ordinary mornings that make life feel like life. If that sounds dramatic, good, because it is dramatic. Mental clarity is not a small thing. It is one of the biggest things we have. Protecting it should not be optional. Reviewing what threatens it should not be rare. And if this message reached you at the right time, do not just nod and move on. Do something with it. Pull out the bottles. Make the list. Book the review. Ask the hard questions. Bring a family member if needed, and keep going until someone takes the concern seriously enough to answer it well. Because the truth is simple, even if the system around it is not. A person can look like they are fading when in fact they are chemically overwhelmed. They can look older than they are because their brain is carrying too much sedation, too much anticholinergic load, too much layering from too many directions. They can be told this is just age, when age is only part of the story. That is why silence is dangerous here. Silence lets harmful routines become normal. Silence lets people suffer privately and assume nothing can be done. Silence lets families blame themselves for missing signs that were never explained to them clearly, but once you see the pattern, you cannot unsee it. You start noticing the nighttime pill, the bladder tablet, the older antidepressant, the anxiety medicine, the extra over-the-counter product that no one counted. You start seeing how easily a sharp mind can get buried under treatments that were never reviewed together. And maybe most importantly, you start seeing that the first step back is often not mysterious. It is practical. It is organized. It is one careful review, one honest conversation, one safer substitution, one unnecessary medicine removed at a time. That may not sound dramatic enough for the internet, but in real life, it can change everything. It can protect years of clarity. It can prevent panic. It can restore trust in your own mind. And that is why this message deserves to travel. Someone near you may already be showing the signs. Someone near you may already think decline is unavoidable. Someone near you may be one medication review away from a very different future. And if that person is you, then let this be the moment you stop assuming and start checking. Your brain deserves that level of care. Your future deserves it too.